At first I thought that this was going to be like a group motivation program where we're going to motivate each other with our experiences and our encounters with the patients. But then I see that we have a lot that we keep hidden our insights, and then when we share the experience with our friends, then it was so educational, and it started reflecting on our patient experiences also. We all have a way of approaching the patient, different ways of approaching the patients, different patients actually. But now we know how to approach a human being, not just a patient, not just the name, not just a chart. So we know what to do when we see a patient, when we see a human being, when we see a spirit. So that's a wonderful thing that we got from this program. With a patient in the unit, he was refusing all treatment options, and he was actually being very rude to the attending, rude to us, rude to the staff and nurses, and everyone was ready to discharge the patient. And everyone was so sick of the patient actually. But even I was feeling like that because I was post-call, and you know, the fatigue and all that kind of stress sometimes reflects on you. But I just sat down, listened to myself, thought about the experience that I got from this group, and approached the patient in a way that he was never approached. Talked to him, chatted him about the social stuff, social work, his job, and what was making him unhappy. And at the end of the 30-minute discussion, conversation, he was ready to accept all the treatment options and all the procedures that we were going to do to him. And a week later, he was discharged, and he came back and he thanked me personally. That was a very emotional side for me. Excellent.
Our experience over the last 6 weeks has been a great one. It's been a chance for 11 of my colleagues and I to sit down and just discuss more of the personal side of medicine. Less of the procedural and more of just our thoughts and feelings about interacting with patients and other ancillary staff in the hospital, patients' families. And we got a chance to explore our successes and failures. It's a reminder to sit down, especially when I'm rushed and when I'm in a hurry, or when the patient or the patient's family is exceptionally difficult, to take a little more time and sit down with them and remember to figure out who the person is inside of the patient, and to figure out what it is that I can do for them. Because most of our activities have been a reminder that treating the medical problems are relatively straightforward, but our interactions with the patients are still complex. And so it's more the interpersonal part that we can usually make a difference in, that will make the experience better for both people. At first I wasn't sure what to think about the program, but it's been a great experience. I think from the very first week when we took an opportunity to write what we would want our eulogy to be, I think that my colleagues and I took the opportunity to be just very open about our own personal lives and our own personal beliefs and thoughts. And I think that's really, in my mind, that's one of the things that really made the program enjoyable, is being able to share openly with my colleagues. And I think a lot of times we don't take the opportunity to do that.
I think we grew in terms of our spiritual well-being and our capacity to be healers. I also think that it made us aware of how involved the other residents are with our patients, so it was something like a benchmark for all of us to leave, and I think they set very high standards for all of us to match. And I think it was a very relaxing atmosphere. It let me out away from the work experience, where I could, look back at my work experience, the days that have been by, and then to just reflect upon them with someone else's, the facilitator's input on it. And it just added a whole new dimension to my experience as a doctor. The maturity that I developed during this program, the confidence in being able to be more than a medical doctor, was something that I'm going to take away from this program. Just yesterday, when I was doing my ER shift, I had this patient, she came in, it was her third miscarriage, and she'd never had any kids before, and she was trying very hard to have kids. And she was she was completely, she was so depressed that she had no emotions. She just went through all the rituals as if it just was another process in her life. And at that time, I felt that, you know, I had to do something. I had to make sure that she was okay and that she was not just in a state of shock so much that she wouldn't recover from it. And I got to talking to her, and we connected at a deeper level, and she told me everything. She told me all about her 3 miscarriages and the feelings she had after that. And I was with her throughout the whole time, and, you know, I was very calm and very quiet, and, you know, I let her talk completely. I felt that at that time she did not want me to bring any input. She just wanted someone to listen to her, and that is something that I learned from these sacred vocation sessions, to be a good listener as well. That would be like the key role to being a good healer. I learned a whole lot more about my colleagues in these 6 sessions than I have learned in these 7 or 8 months with them. And I also learned that behind the veneer of just a medical doctor who knows all the facts, who knows all the numbers, who knows all the lab values, there is like this real, alive human being. And when you lift the cynicism, we're all human and we're all prone to make mistakes. But at the same time, we're all willing to admit it, and we're all here just so that we help others, and we just make this a better place to live. And so that was a very, very enlightening experience for me.
Sometimes you feel alone, and it's nice to have a place to share openly about some of your experiences. So that's something I enjoy very much. I enjoyed the most because it was an opportunity to expand on my career and who I was as a person at the same time. We get concentrated so much on the medical aspects that sometimes we forget about the other things, or we don't have an opportunity to improve that, because you just go through day to day trying to read and learn medicine, but you don't have a time to stop and think, you know, how can I can involve my spirituality, or how can I improve my personal relations other than just practicing on patients every day. Mm-hmm. I'm working at MD Anderson right now, and we take call there overnight, and we don't know any of the patients. So we get called frequently to interact with families after their loved ones have passed away without never have meeting them. So after I started Sacred Vocation, I had a call where I had to go to a patient's room and pronounce them dead. And I was able to connect better with the patient's family than I probably would have before. I took more time and listened to them, and I'm very patient, and I think much more understanding than what I would have been in the past. It was very early in the morning after a very long night. It was 6 a.m. I was an hour away for getting off, and I got called to do this. I think normally I would have been pretty agitated that I got called right before I was supposed to leave to go do something. It could take quite a while, but I was able to stay very patient, and the family's very appreciative, and they all gave me hugs afterwards, so that was a first too. So I think that was probably in large part due to the Sacred Vocation.